Good afternoon, everyone. This is the affirmative closing rebuttal. As we conclude this debate, I would like to bring our focus back to the critical question before us. Should municipalities experiencing an opioid crisis create safe injection site? The affirmative has demonstrated that the answer is yes. Throughout this rebuttal, the negative repeatedly argue that safe injection sites are not proven enough and that we should continue researching our alternative instead. However, the resolution is not asking whether safe injection sites are perfect. It is asking whether municipalities facing an ongoing overdose crisis ought to implement them as part of the response. The evidence shows that they should. The negative entire position ultimately depends on the idea that because some questions remain unanswered, we should delay implementation. But during a public health emergency, waiting for perfect evidence comes at a human cost. Every day, communities lose people to preventable overdose. Safe injection sites provide immediate overdose intervention, connect individuals to healthcare service, and reduce the spread of infectious disease. These are benefits supported by the broader body of public health literature, including the systemic review by Levingood et al. 2021. The negative also argue that these facilities may be difficult to implement and may not be used by everyone. However, difficulty does not make a policy ineffective. Hospitals, addictions treatment centers, and public health clinic all face logistical challenges, yet we do not abandon them because implementation require effort. The question is whether safe injection sites provide meaningful benefit when they are established. The evidence show that they do. Importantly, the negative never present a superior alternative. Instead, they ask us to continue researching while overdose death continues. Research is valuable, but research alone cannot reverse an overdose occurring today. Safe injection site can. Samuel et al. 2022 described overdose prevention center as an important harm reduction strategy because trained staff can intervene immediately when an overdose occurs. A person who survives an overdose has the opportunity to enter treatment and recovery. A person who dies does not. The negative also claimed that public opposition and implementation barriers make these facilities unrealistic. Yet history shows that many effective public health interventions face resistance before becoming accepted. Needle exchange programs, smoking restrictions, and HIV prevention initiative all encounter public skepticism. Public health policies should be guided by evidence and outcome, not popularity. Finally, the negative spent considerable time discussing procedural concern and hypothetical limitation, but debate rounds are won on the strength of the arguments supporting the resolution. The affirmative has shown that safe injection sites reduce harm, prevent overdose, that connect people to treatment, and improve public health outcomes. The negative has raised concern, but concerns alone do not outweigh documented benefit. When weighing this debate, ask yourself one simple question: which approach saves more lives during an opioid crisis? The affirmative offer an evidence-based intervention that has been associated with reduced overdose mortality, increased healthcare engagement, and improve health outcomes. The negative offer continue waiting and further study. In a crisis where lives are at stake, municipalities should use every effective tool available. Safe injection sites are one of these tools. For these reasons, I urge you to affirm the resolution that municipalities experiencing an opioid crisis ought to create safe injection site. Thank you.